Perfect. Okay, just checking. So thanks for having me again. It's nice to see everyone. As always, I'm here to talk about family systems, loved ones, however that's defined, in the various worlds in which you work, which I always love coming to this echo to see how people in their professional areas are thinking about involving family systems and those that support individuals in your care, and what you'd like to see done differently. So I would encourage you as we go through today for maybe some discussion at the end, if there's time, to think about, what you're doing already in these spaces and as an individual provider or within your agency or hospital system and what you would like to see done maybe a bit differently. Um, first talking a bit about the importance of involving loved ones, and we'll get a little bit into the research about how we know that this from 40 years of research now that it can really have a great impact on the individual's treatment and recovery, but also those around them. But as we go through the talk today, terms like loved ones, family system, natural supports that the individual identifies, really be thinking broadly and inclusively about who that might be. So for some individuals, it may be a neighbor, it may be a member of their clergy, or a spiritual support person. So really thinking outside our normal box of when we say, who are your supporters or who is your family, when we're doing our intakes and initial assessments. So I like to think about it as those individuals in someone's life who really play an important role in that person's life. There's typically a bi-directional impact or influence that's occurring when you think about somebody that's really part of that inner circle or that network. So what's going on with the individual is impacting those in that close knit network or those that are important to them. And vice versa, what's going on with them is impacting the individual. And oftentimes there's a level of influence as well, from those important people. In our lives, if we think about ourselves, and the bi-directional impact and influence, and dynamics that are always at play in our closest circle. So why family systems, support persons, and why now? So we know from, history, in addition to the fact that it can be very helpful, but oftentimes families can be viewed as problematic, or as taking more time to get your work done, more phone calls. They're problematic because, they're not following through with the treatment plan. They're undermining what the treatment team is doing. Those are things that I hear pretty often. And so thinking about within your space, with the treatment teams with whom you work, how can we move if these kinds of thoughts are occurring and discussions are occurring, moving toward more solution focused discussions about including family systems. Typically in my universe, with schizophrenia spectrum disorders, we're absolutely thrilled when an individual has supportive and knowledgeable loved ones involved. But truly, this could and should, I hate to should, but should be the norm. If we think about other spaces, individual goes in for a minor procedure. They go home, they have to have a drive home, somebody to drive them home. They have to have somebody there that speaks with the nurse to know what the follow-up plan is. They have to know who to call and when to call if things seem to be going awry or there's a crisis situation. And unfortunately, those things aren't always able to happen in psychiatry. And so, encouraging individuals to include supportive people in their lives by helping them to think a bit bigger about who those people are that could be included. And I think we've mentioned before, thinking about the types of questions you are asking to elicit important individuals to that patient of yours or that client of yours. So, who do you call in an emergency versus who do you call if you need to run to the store versus who do you call to share you're having a really good day or a really bad day. And then the flip side of that, I think, is another space where we often miss an opportunity. And that's by asking who calls you, to find out, if they're to find if you can offer them a ride, offer them support, share in their victories. So who is calling you? And so there's a really good opportunity there, to find out, who those people are. And if that isn't occurring, who do they wish was calling? them, or who does the patient wish they could still be calling, and what was the breakdown of those relationships? So it can really just help to identify some people in their world, and in their universe that really can make an impact on them. So, involving loved ones can be difficult, but there's such a great deal of assistance that they can provide in various kinds of ways. And so, they can be a help to our work, or they can be a hindrance, but that's really determined by us as providers. We really have to be the guides or the roadmap, setting the expectation that a family should make sure somebody takes their medications when it's a 24-year-old young man, who has just moved back home following his first episode of psychosis. That can often create tension within the household. And then those people that were his primary supports now become what he feels are his enemies, or there's a lot of strain. And so making sure that we're providing them guidance about what is the best fit for their family at this time, and what that role that they're going to play in the individual's treatment and recovery journeys will look like. So I alluded to, research support. So there's been 35, 40 years of research now saying that when you have family members, family systems that are both knowledgeable about what's going on with the individual and appropriately supportive, that outcomes are improved. And that's outcomes for more than just the patient. So with the patient, we know that they're more adherent to treatment recommendations, not limited to medication, but treatment in general, which means they're less likely to, they're having fewer psychiatric symptoms, which means less likely to have a relapse and go back into the hospital, which helps our system, right, by decreasing costs of care in that way of repeated emergency department visits or psychiatric hospitalizations. But we also know that family members, when they are in this space where they are knowledgeable and supportive, and they know what the expectations are of them, they know how to intervene before a crisis occurs, or who to call when a crisis occurs. They know those warning signs to look for, that they're feeling less burdened. They're feeling more confident and competent in what they're doing. The family relationships are improving. The social functioning and even work functioning, vocational functioning are improving for everybody. And just an overall sense of well-being across the family, when they know, how to be supportive of the individual in psychiatric treatment. So there are some guidelines that were first written in 1994 and have gone through a couple iterations, but it's called the Schizophrenia Patient Outcomes Research Team. And they got together and did a very large meta-analysis looking at recommendations for individuals living with schizophrenia. What are the best treatments available? It talks about medication in there. It talks about cognitive behavioral therapy for psychosis. And since 1994, and in every iteration since, one recommendation has always remained, and that's to provide family-based services. And that can look different, but in its ideal form, it's the evidence-based family psychoeducation that's at least 6 to 9 months. But we know that that's not feasible, or desirable for everybody. And so they did find that if there's at least 4 sessions offered in less than 6 months, where family members are getting some support, they're getting some information, they're getting some skills practice, that even if these shorter term interventions aren't the full family psychoeducation, you still see some benefits and some outcomes that are improving, just perhaps not quite as robust as someone who is involved for that 9 months to 2 years. So things that we can do as providers and individual providers, and as, healthcare systems, wherever we may fall in our work. But when working with individuals, thinking about that individual within a larger system. So as we mentioned, what impacts the individual impacts the system. What impacts that family system impacts the individual. And so while being sensitive to, of course, the patient or the client with whom you're working, with their experiences, also understanding that that family has lived experience, within what's happened with the client, if it's a psychiatric, mental health issue or a psychiatric condition, or any kind of trauma or shared grief or experiences. These individuals are being impacted as separate individuals, and it's impacting them as a unit. And so some things to consider when you're thinking about The individual with whom you work within that larger system are things like cultural factors, beliefs and value systems, heritage and traditions, religion or spirituality, life experiences, trauma, either individual trauma or shared trauma, all of these kinds of things. One I do like to highlight is thinking about, oftentimes people come to us as providers seeking assistance and support and guidance. And so when we make recommendations, for example, the easiest one to think about is medication. So somebody comes to see us, we don't really know the family's value system, and we're talking to the individual, and they say, sure, yes, I'll take medication. They seem to not be following up or following through with the medication. When we are able to speak with that individual and explore, what tell me what is the what your family system, the people with whom you live or the people with whom have an impact over on you or have some influence over you, what are their thoughts about mental health? What are their thoughts about treatment? What are their thoughts about medication specifically? And we oftentimes will find that the individual, though desiring following through with the treatment recommendations, they go home to a space and individuals who perhaps this isn't part of their value system or it is directly against what they believe. So, if individual says, mental illness is for the weak or, medications are poison. So the individual with whom we work is now in this kind of double bind, do they be the quote good patient or the good son or daughter? And it's unintentional on our part, but we haven't really done our due diligence at the front end to ensure that they're going into a space that's going to be supportive. And if we find out that it is against the value system of this particular family about mental health treatment, whatever it might be, without having that initial contact, talking about what the reservations are, the thoughts are, how that individual can navigate, the different directions in which they're being pulled, it can be really difficult for the individual to follow through. And so just something to think about, that even level of impact and how important it is to kind of get a clear picture, at least from the individual, on their perspective of how they see their system around them. So identifying goals and needs. So, as loved ones, what do they typically want? They want to be heard. They want to be understood. They want to be helped and supported. They want to be a part of the team, not just sort of in talk only of, of course you're part of the team, but truly being a part of that treatment team. They really want to be of help. And the only way of knowing what their real needs and goals are by asking them. There's always that saying of, meet the client where they're at. And I think that's true for the people in the system because everybody will be at different places. And so making sure that we're we alluded to, that we're aligning those goals and needs and values for the individual and those that, impact or have influence over them. And looking for that space. So if a family system doesn't believe in mental health treatment, for example, and the individual is interested in pursuing treatment, the common ground, it might seem like we're worlds apart. And how do you ever find any common space? The common ground in a way to kind of bring down some of those walls is really, ultimately, I think we all as treatment providers, the individual and the family system want the same thing. And that's this individual living a really healthy, happy, productive life. And so if nothing else, we're all on that same page and that gives us a place to work from. Thinking about how, I've used the word engagement and thinking about how engagement looks within a particular family system. And so thinking about, what are their current needs and capacity and ability? So are they able, and is it healthy for that family member to make sure an individual is taking their medication? Or is that outside of their current capacity? Is that not a need? Or is this something that's creating tension? What are things that might get in the way of a family system being involved, and that can look many different ways. Is it the individual who's hesitant and has some reservations about pulling family members into their treatment? Is it the family system that is, their stigma, or they're unsure? I drive him to his appointment. What else can I do? You're the professionals. And so they don't really know what their role looks like in this world. And again, that's being sure that we are offering guidance and being that roadmap. What facilitates engagement? If you had a family system who were really, attentive and attending all the appointments and doing all the things, and something has shifted, what changed over time, and what was working in the past and what didn't work so well? Discussing expectations of all involved, so that's not just expectations of the individual, to follow through with their treatment plan and, to meet those treatment goals and to take their medication, but also what are the expectations of us as a provider, or us as a healthcare system or a treatment team? Because expectations may not be realistic for, for what we are able to do and how quickly we're able to do things, but also expectations of the family system or those, important support persons. Is the expectation that they'll have some level of involvement? Is the expectation that, they'll just answer the phone when somebody calls? Is the expectation that they'll be able to provide rides? Whatever it might be, we just want to make sure everybody's on the same page. And that the expectations for everyone are realistic, reasonable, and feasible. And does that family system know what our expectations are as providers? Are there expectations of that we have for them as providers? And something to really evaluate and give us pause in what we do. I would encourage us to take a stepwise approach to engaging family systems and treatment. So in addition to some of those questions, and asking the right kinds of questions in the right kinds of ways to elicit, names of people who might be important in that client's life. But so once we find out who supports the individual, talking to the individual about what it might be like to involve them, what are their reservations, what could go well, what might not go so well, what are they most fearful of, normalizing and validating those concerns that this is a big decision, but talking about, do the benefits or potential benefits outweigh those potential risks, and allowing them to be in the driver's seat. And then pulling in those loved ones, family system to really provide education and information and that support. And oftentimes family systems just need support for their own journey that they're going through. They're going to need resources for their own journey that they're going through. But also, they need support as they build confidence in trying out new techniques, maybe that they're learning with you, or new recommendations that you're making, so that they know that they have someone to call to process whatever new skill they implemented. Being prepared, obviously, I've talked a lot about how helpful and important it is to engage family systems, but obviously important to first assess readiness and appropriateness, because safety is always first. So ensuring there's no orders of protection or history of domestic violence. Thinking about how the family system communicates, talking with that individual about, what does it look like when you guys aren't getting along very well? Oh, okay. So you argue. Does that escalate? Is there a lot of yelling that happens, or name calling? Has it ever led to pushing or shoving? Finding out if there's high levels of expressed emotion. So that's when their family system is very critical about the individual. There's a sense of hostility or resentment that they have towards the individual, or they're so emotionally invested that they're not able to pull themselves away to allow that individual to progress and gain some independence and grow. Other things that we can do: providing support, ensuring that the family system understands that they have a role and what that looks like over time, because it will look different over time. At some points in time, for all of us, whenever we've been the patient, you need more support, you need more assistance. And then as you are feeling better, as you're improving, that family system or those family members start to take a step back. And with psychiatric conditions, especially something like a first episode of psychosis, for example, sometimes that's the hardest part for families because they have stepped back in. They've been tightly controlling what's happening. They're very in tune with what's going on. And so it's terrifying to think about stepping back out and allowing that space for some independence because there's always the what ifs. Well, what if he has a relapse? What if, something goes wrong? And so helping families figure out and navigate what that stepping out process looks like. And when we're providing information and resources and things like that, just making sure we're sort of reading the room and not overwhelming with so much information and a flood of resources all at once. So in your world, in your work, I know people are in all different places and spaces, thinking about what it looks like today with the level of family system involvement, a support person's involvement. Is it part of an intake process? Do family members often attend appointments? And how you might want to see that change in some way, or have more active participation from family systems, and thinking about, yeah, as individual providers or within your network, what could get in the way, what might facilitate involvement. And so, I'd love to hear any thoughts if we have time, but I'll leave that to Nicole. So thank you all. I have posted this on iEcho, so the slides are available as well.